Absolutely. I'll start the recording at this point.
Okay, so good morning or afternoon or wherever you are. I just woke up and had a cup of coffee. I'm going to start out by sharing my screen. And that is working, which is really lovely. Let's see if I can make it do its thing. Okay, so I'm going to be reflecting on the impact of the war on Gaza and how it has affected healthcare and human rights. So I think the important thing to start out with is to remember that healthcare is provided in the context of siege, checkpoints, closures, curfews, a very strict permitting system for patients who need to get in or out. Then there's the separation or apartheid wall or fence, depending on where you are. Frequent Israeli incursions, massive assaults, frequent detentions, as well as factional violence. Now, I want to have people reflect on some of the ethical questions around healthcare that are important to think about when we're thinking about healthcare in general. And one is, and I want you to be thinking about these as I present the data. So think about international humanitarian law, the role of collective civilian punishment, the role of restrictions of access and ghettoization of an entire population, mass incarceration, especially of children, and the proportionality in war. And the thing to remember is that healthcare and healing occur in a socio-political context, and that we need political solutions to health and human rights issues. And you can just ask yourself, why is life expectancy in Israel 10 years more than in the West Bank and Gaza? Why is maternal mortality 9 to 10 times greater in the occupied territories than in Israel? Now, a couple of years ago, several humanitarian organizations came out with analysis that stated that Israeli behavior had met the criteria for apartheid. And this is a quote from B'Tselem, which is an Israeli human rights organization. And they stated a regime that uses laws, practices, and organized violence to establish and maintain the supremacy of one group over another is an apartheid regime. And this also applies to medicine. So there is medical apartheid. And we really saw this quite clearly during the beginnings of the COVID pandemic. So what we see is that the Oslo Accords in 94 set out the Palestinian Authority to have responsibility to create and manage a healthcare system in the territories. But they were predated by the Geneva Accords, which mandated that an occupying power is responsible for dealing with the spread of contagious diseases and epidemics. So what we saw was that Israel wanted Palestinians in the territories to have the responsibilities of sovereignty, in other words, providing health care, without the benefits of sovereignty, resources, and control over the system. So a person's response to the pandemic totally depended on their geographic, ethnic, and political status. And I'm going to read this slide because it is the take-home message if you forget everything else. More than 75 years of Israeli domination and dispossession has affected Palestinian life through occupation, siege, annexation, de-development, and permanent displacement of refugees, severely impacting the ability of Palestinians to access the essential building blocks of health. The fragmentation of society and destruction of the ability and opportunity to create essential institutions involved in healthcare has created a reality that is recognized today as medical apartheid. Two separate systems, two separate realities. And we see this in the impact of the disparities on life expectancy and maternal and infant mortality. And medical apartheid comes about through the active de-development of the healthcare system by the Israeli government, not permitting staff to get higher level training, not allowing institutions to grow and develop. Then the whole system of medical permitting. So if you're a very sick person and need higher level care, you have to go through bureaucratic hoops to get medical permits to leave. These often don't come through or they're late. Then there's the chronic shortage of medications and equipment, as well as direct attacks and high levels of conflict-related trauma. I also just want to put out there that there is an impact between Zionism and medicine. So in 2018, the Israeli Knesset, their parliament, passed the nation-state bill, which officially privileged Jewish citizens of Israel over Palestinian citizens. So there is a form of institutional racism in Israel. So the question we have to ask is, are Jewish Israeli clinicians able to see Palestinian citizens of Israel or Palestinians in the territories as fellow equal human beings? And I should note that in November of last year, there were 100 doctors that signed a letter that basically approved the bombing of Gaza hospitals. Now, I'm going to talk about health in its broadest sense, the right to health. And this list comes from Physicians for Human Rights Israel. So the right to health involves freedom of movement and access to health services, and then all of the things that make up a healthy society: clean water, sanitation, nutrition, housing, education, employment, and the ability to live in a nonviolent society. And the picture on the right is a patient education pamphlet from the Palestinian Medical Relief Society. And along with their pamphlets for pregnant women on importance of breastfeeding and taking calcium and that kind of stuff, is a pamphlet on what to do if you're trapped at a checkpoint in labor. Now, I keep mentioning international humanitarian law. This was codified in the 4 Geneva Conventions of 1949 that basically outlined the protections of civilians in times of war. They treated as war crimes the murder of civilians, torture, rape, and hostage taking. This is part of an international law, a body of rules governing relationships between states. Subsequent to that, there were additional protocols relating to the protection of victims of armed conflict, and other agreements that prohibited the use of certain weapons, military tactics, and protected certain categories of people and goods. In 2000, there was the protocol to the Convention on the Rights of the Child, looking at the involvement of children in armed conflict. Now, healthcare in Palestine has been defined as fragmented and incoherent by the Lancet. We have the Ministry of Health, which was established in 1994 post-Oslo. And then we had the United Nations Relief and Works Agency, or UNRWA, which was established in 1950 after the 48 war. Gaza has 8 overcrowded refugee camps. The West Bank has 23. Then there are non-governmental organizations, just like the Palestinian Medical Relief Society, as well as a host of private providers. And on top of that, we have the role of the Israeli government in the development. If you live in East Jerusalem, Israel 48, you do have access to the 5 HMOs that are present in Israel, as well as to private care. So those Palestinians live under a very different system. Now, if we look at the Gaza Strip in the upper left corner, we see Israel with West Bank as a little kidney-shaped part on the eastern side of Israel, and the Gaza Strip is that little black line. To the south is Egypt, to the east is Jordan, further north is Syria and Lebanon. If we look at the blow-up of Gaza, in the north, there's a border crossing called Erez. That's where people like me go in and out. In the south is Rafah, which is the border with Egypt, which is where many people are trying to leave. There also, aid comes through Rafah, as well as through one of the southern border crossings called Kerem Shalom. And a Gaza Strip is 28 miles by 6 miles in size. If you look at and put it on top of the state of Massachusetts, which is a tiny state, you can see how tiny Gaza Strip actually is. Now, there's some basic facts of occupation. This is just to give you a quick historical rundown. Gaza was occupied in 1967 by Israel. It was before controlled by Egypt, before that by the Ottoman Empire. Israeli settlers moved in. They were withdrawn in 2005. Then there was a democratic election certified by Jimmy Carter, and Hamas won the legislative election. It's important to remember that their platform was clean government, not driving Israelis into the sea. The following year, there was a civil war between Hamas and Fatah, another Palestinian faction, and partly funded by the US. And Hamas won, and then the international community, led by Israel and the US, began a strict siege. Since then, there have been multiple Israeli assaults, 2008, 2012, 2014, 2021, 2022, and now the assault that started on October 7th. In addition, between 2018 and 2019, there were weekly protest marches, mostly peaceful, called the Great March of Return. And these protesters were met with sniper fire aimed at the lower limbs. So there was a massive amount of orthopedic injuries on top of everything else. And I have this picture that I took in 2014, just to remind you that the issues in Gaza have gone on for a long time. Here's a guy using his horse to draw a cart with fuel tanks, and the fuel tanks are used to generate electricity. So electricity has been a long-standing issue, or the lack of electricity. Now, these are a few personal observations about care. Palestinian healthcare is partly first world and partly third world. And just to give you some examples, I was in Al-Ahli Hospital in Hebron, which is on the West Bank, observing a C-section. And the OR standards, the operating techniques were very third world. The patient had general anesthesia because they don't have regional blocks. I went to the Ministry of Health Hospital in Jenin to the delivery room. It was a pretty stark place with 3 delivery tables, with the big stirrups all in a row. Women delivered in the same room without supports, lying flat on their backs. And then I went to a birth center in Maithalun, also in the West Bank, which could have been a birth center anywhere in the US. What I found was that patients have minimal time with clinicians, especially in the UNRWA clinics. Doctors will often see 40, 50 patients an hour. If you look at maternal mortality, there was one study that showed in Gaza, 50% of the women who died bled to death and 25% died from infection. This is very different than in the West Bank, where a third died of pulmonary embolism and about a fifth from preeclampsia. So the causes of death mimicked the level of inequality and the level of development between the two settings. In gynecology, I found minimal knowledge about the body for most women, particularly prior to marriage. The most popular form of contraception was the IUD, and it was used for spacing. The expectations for exams were very, very modest. I often spent 20 minutes trying to convince a woman to have a pelvic exam. Everyone thought they were going to get an ultrasound, even when they came in for vaginitis. Women suffer from a lack of exercise due to siege and occupation, and from the dietary changes with the loss of agricultural land and dependence on neoliberal Israeli policies. And Israel completely controls what foods are grown, with the imports, the exports. And then there's the whole issue of shame, gender-based violence, response to rape, and family honor issues. Now, I've been to Gaza 4 times, each time with a different NGO. The last time I was in Gaza was in August. I went with Grassroots International and was invited by the Gaza Communal Health Program. So over the course of the years, I have done direct services, women's empowerment, interviewing, blogging, documenting, et cetera, et cetera. And I continue to work with a number of groups that are focused on Gaza. Now, when I came in August, around 18,000 Palestinians from Gaza were working in Israel. They had economic permits. Of note, they did not have any healthcare coverage. And so when they got injured in their high intensity, high dangerous jobs in agriculture and in construction, they were basically dumped back into Gaza, where there was not adequate healthcare. For the first time in my life, I saw child beggars on the street, heard reports of men selling their kidneys to feed their families, and families unable to afford olive oil. In August, the UN came out with an analysis that of the exit permits from Gaza, they were 88% below the monthly average in 2000. The vast majority of these exit permits were for work-related issues, and only 6% were from patients referred for medical treatment in the West Bank or Israel, and 19% of the exit permit applications were not approved on time. So you take the sickest people, you put them through bureaucratic hurdles to get a permit, and then the permit is not approved or delayed. Now, pre-aggression, there were 13 governmental hospitals, 142 primary healthcare centers run by the Ministry of Health, UNRWA, and NGOs. There were approximately 40 private hospitals, 2 medical schools, and a bunch of professional schools. But there's a real disconnect between the people who are trained and the jobs that are paid and available. So there were 120 nursing positions open each year and 5,000 nursing students in Gaza. There were less than 20 psychiatrists in Gaza, less than 7 of them are physicians. Now, the big health issues before the assault were electricity, often 4 to 8 hours per day at erratic times. The fuel shortages resulted in the inability to generate electricity. Sometimes hospitals had to close. There were the severe restrictions on permits and shortage of medicine and equipment, as I mentioned. There's a huge lack of specialists because doctors cannot get out of the Strip to have high-level training, and the medical personnel are exhausted. Salaries are often unpaid, and the COVID-19 pandemic was particularly difficult for them. If we look at UNRWA funding for the refugees, it was totally slashed by Trump, partially destroyed by Biden, and right before the aggression, the assault, there was a threat to cease operations due to budget crisis. This was all in the face of deepening poverty, rising malnutrition, and rising unemployment on the Strip. Now, the Israeli siege not only controls everything that goes in and goes out, but there are other things that they do. So there's a policy of fumigating the farmland with herbicides along the eastern perimeter fence and killing the crops and poisoning the land. The Israeli military has decimated the fishing industry. Gaza is a fishing culture. It's on the sea. That was one of their main sources of protein. And they've destroyed this by severely limiting the fishing zones, and it keeps changing and is erratic, and repeatedly attacking fishermen and their boats, killing them, destroying their boats, et cetera, et cetera. There's also been intentional flooding of crops along the eastern border, where they have these wells and they wait, the Israeli military waits until the crops are about to be harvested, and then they flood the crops, destroying them. And with all of this, we have 2.3 million Gazans, and half of them are under 18. Now, we are on day 113, and there has been a total disintegration of the healthcare system. More than 26,000 people have been killed in Gaza. More than almost 65,000 have been injured. In Israel, around 1,100 were killed during the Hamas attack. 219 Israeli soldiers have been killed in Gaza and over 1,200 injured, and it's estimated that there are 136 hostages still in Gaza. The Israeli military has struck homes, civilian gatherings, markets, houses of worship, bakeries, restaurants, ATMs and money changers, hospitals, healthcare facilities, ambulances. There has been a full electricity blackout, a lack of fuel, and now an attempt to create a buffer zone by destroying all the buildings along the perimeter. In the hospitals, 14 of the 36 hospitals are partially functional, 7 in the north, 7 in the south. They have an occupancy rate of 206% on the inpatient department and 250% in the ICUs. More than 60% of the housing units have been destroyed or damaged. So when people talk about going home, the majority have no homes to go to. 75% of the population, 1.7 million people, are internally displaced people or IDMs, sheltering in all sorts of UNRWA and emergency sheltering. There's a severe shortage of drinkable water or water in general, medications, and a risk of famine and starvation. And the risk is here. There are people who are living under famine conditions and who are starving. And their main source of food is either aid or the black markets. And with the increasingly difficult conditions, there are increasing intracommunal tensions and gender-based violence. And on top of this, there are about 50,000 pregnant women. Now, the Israeli forces have deliberately attacked healthcare personnel, 337 killed, 121 ambulances destroyed. They've killed 152 UN staff. And as I said, more than 2/3 of the hospitals and health centers are no longer functioning. There have been no medical permits to the West Bank or Israel for high-level care. Clinicians are reporting major unusual burns on the dead and wounded, raising the specter of white phosphorus, which is a military weapon that's illegal in urban settings, and women have almost no menstrual or hygiene products. In terms of mental health, this is affecting everyone. There are reports that children have developed convulsions, bedwetting, increased fear, aggressive behaviors, nervousness, and refusal to leave their parents' side. UNICEF has now said that Gaza is the most dangerous place in the world to be a child. At the two crossings, the Rafah crossing in Egypt and the Kerem Shalom crossing in southern Gaza into Israel, there are hundreds of trucks carrying food, water, and medical supplies. They are only intermittently allowed to enter, and the amount of aid is pitifully low. There was a telecom blackout. I think it's the 7th one, starting on the 12th. I've now heard they're beginning to fix it. And a few days ago, the Israeli Defense Force destroyed the Al-Isra University, which is the last remaining university in Gaza. The Israeli forces are using water as a weapon of war. If you take the water trucking that can be done and the water from the functional desalination plant that's still working and the restoration of one of the 3 main water supplies that happened on December 30th, this is water from Israel. This has yielded 7% of the water needed for Gazans, and they also have no chlorine. Most of the sewage pumping stations are not operational. All 5 of the wastewater treatment plants are shut down, so raw sewage is now being dumped into the Mediterranean Sea, where people are cleaning their clothes, bathing, and sometimes drinking. It's gotten much worse with the cold, rainy weather. I've been there in January. It's pretty miserable. And so now there's flooding with raw sewage. As you can imagine, with these kind of hygiene problems, chickenpox, scabies, lice, diarrhea, respiratory illnesses, and hepatitis A have significantly increased. In addition, there are 6,200 people waiting, severely injured people for treatment abroad, and there are over 10,000 cancer patients who are at risk for death because they no longer have treatment available. We are seeing an increase in denial for humanitarian missions by the Israeli military, particularly in the north. We have seen recently Israeli protesters blocking aid from going into Gaza at the Kerem Shalom crossing. We see a high risk of explosive and unexploded ordnance that is contaminating the environment. And while all of this is happening, Palestinian armed groups are continuing their indiscriminate rocket fire into Israel and active on-the-ground fighting. And the civilians are caught in the middle of this. And so now many folks are talking about the risk of genocide and war crimes. I just want to remind people that there is a tremendous amount going on in the West Bank and East Jerusalem. People are talking about the Gazification of the West Bank. There have been multiple Israeli attacks on Jenin, Tulkarm, Nablus, and other places. There have been obstruction of ambulances. There are waves of Palestinian resistance and arrests and detentions. More than 380 Palestinians have been killed. 4,000 injured, and over 456 Israeli settler attacks. These settlers are heavily armed. There's been a massive distribution of guns. The Israeli settlers are often either protected or joined with Israeli military. And this is especially going on in Area C, which is the 65% of the West Bank that is totally under Israeli control. And so there have been continued land seizures and illegal outposts. And there's been a 60% increase in home demolitions in East Jerusalem since October. Now, I want to just look at a couple of particular institutions. As I mentioned, I was invited to the Gaza Community Mental Health Program each time. This is their newest building, or was their newest building, opened in 1990, built before that. And they had 3 centers and 5 mobile clinics. And this was a very important organization, training mental health workers, doing direct care, doing community education, working on reducing the social stigma for mental health. And they also had a hotline. Their focus was women, children, prisoners, and chronic traumatic stress disorder. There is no post-traumatic stress disorder in Gaza because nothing is ever post. The very impressive part of their work is that they use evidence-based interventions. Now, I know that this whole area had massive bombing. The roads are all cratered. The windows on this building were blown out. I've been unable to find out if it's still standing, but I do know that all the centers are closed. The hotline is barely functional because there's no electricity. People don't have working telephones. The patients were given the phone numbers of their therapists, but there's inability to contact them. They also used to get very free medications here, so they have to buy their own medications, and medications are not available in the pharmacies, so we have mentally ill patients without medications. In addition to this, the staff are as traumatized as the patients. The staff have lost 10, 20, 30, 40 family members. The staff are living in shelters and tents as well. Now, I want to just also focus on Al-Shifa Hospital as an example of what happens to the hospitals. This was the main hospital in Gaza City, 700-bed hospital on a huge complex with 1,500 medical staff, including 500 doctors and 760 nurses. Now, before November 15th, it had been bombed. The surgery department, the coronary care division, a warehouse, maternity floor, and an outpatient clinic. Israeli troops and tanks entered, took control of several sections of the hospital, and interrogated people. They stormed nephrology and internal medicine, and they detonated a medicine storehouse. On the 15th, they ordered all the young men in the hospital grounds to surrender. They took captive dozens of displaced people because people shelter in the hospital, relatives of patients, as well as injured people. Many Palestinian men were interrogated, some while being held naked and blindfolded, some taken to unknown locations. The Israeli military and government accused Hamas of placing a command center below the hospital. The hospital officials and providers denied the claim. The New York Times was able to enter the hospital and found the soldiers' findings or claims really unconvincing. There were no reported clashes of Hamas gunmen on the site, and we know that patients in the ICU and the NICU died due to lack of electricity, oxygen, and water. This is a picture from the New York Times of babies in the NICU. When their incubators failed due to lack of electricity, the staff cuddled them all together, hoping they would keep each other warm from body heat. More than 7,000 patients were sheltering inside Al-Shifa. At 9 a.m. on the 17th, they were ordered to leave in 1 hour, which was totally impossible. And there were no ambulances for transportation and no fuel for the ambulances. The situation caused, quote, great panic and fear. Many people left on foot. People were pushing wheelchairs. They were pushing gurneys. And then those who could not leave were forced to remain behind with a handful of staff. On January 22nd, there was a high-risk mission to resupply fuel to the hospital. There are now 120 health workers there with 300 patients. They are doing 5 to 10 surgeries per day, mostly related to trauma. They have basic labs, X-ray, and emergency care, some post-op and dialysis units, and they have internally displaced people, but the number which peaked at 40,000 is now 10,000. I want to talk about pregnant women. There are estimated to be 5,500 births per month. So I should tell you, I did write an op-ed that was published in the New York Times about pregnancy in Gaza, which you can certainly Google and find. These women are having next to no prenatal care. Many of them now are internally displaced. And the important other thing is that they don't know where they're going to deliver. So we have 180 women a day giving birth without adequate care. Some are undergoing cesareans without anesthesia or painkillers. Many are discharged if they get to a healthcare facility within hours of their deliveries. And it's estimated that 15% of these pregnancies and births are high risk. So these women are giving birth in shelters, in their homes, and in their homes they also have, 40 relatives, in the streets amid the rubble. In overwhelmed healthcare facilities, the sanitation is horrific. The risk of infections and medical complications is on the rise. This is a picture of a woman who's recently delivered in a tent in Rafah in southern Gaza, and now she's washing her baby off. As you can imagine, the lack of food and clean water, the levels of hunger, starvation, and dehydration, which are bad for everyone, are particularly bad for women and pregnant women and babies because they are very vulnerable. So this has an impact on the health of the mother and the baby. It also impacts on the ability of the mother to bond and to breastfeed. Dehydrated, hungry women who are totally stressed will have difficulties breastfeeding. So then the woman is faced with trying to find formula, and the powder is very expensive. And then they have to mix it with water, which is contaminated with fecal material and God knows what else. We know that the medical facilities that have remained open are overwhelmed with people who are wounded in airstrikes. So a woman coming in labor is competing for care with all these other folks. So we know that maternal deaths are going to rise and that there is a massive psychological toll. All of this kind of conditions has consequences on reproductive health. There has been a documented 300% rise in stress-induced miscarriages, and there will be a rise in congenital abnormalities, stillbirths, and premature births. And all of these things have a multi-generational impact. Now, you may remember that The South Africans have brought an 84-page complaint against Israel to the International Criminal Court. They've accused Israel, quote, of a calculated pattern of conduct indicating a genocidal intent, and they have evidence of intent through the language of the governmental leaders and then the facts of the assault. And just to remind you, in 1948, we had the Convention on the Prevention and Punishment of the Crime of Genocide, where genocide was defined. So genocide is defined as specified acts committed with intent to destroy, quote, a national, ethnical, racial, or religious group. Acts include, quote, killing members of the group and deliberately inflicting on the group conditions of life calculated to bring about its physical destruction in whole or in part. And also, I just want to call attention to an article that was just published in The Guardian that documented longstanding policies by successive U.S.-Israeli governments to shield Israel from U.S. laws that are supposed to prevent U.S. funding of human rights abuses. You may have heard of this as the Leahy Law, and Israel has not been subjected to those rules. And this has been true through multiple different governments. Now, you may have heard that yesterday, the ICC, the International Criminal Court, had a preliminary decision that is very important. First of all, they said that South Africa does have standing to bring these charges, that genocide could be happening, that Palestinians are a protected group. They reviewed the conditions in Gaza and the dehumanizing language from Israeli ministers. And they didn't call for a ceasefire, but they said that Israel must take action to prevent genocidal acts and increased aid, and must report back in 1 month to show that they are doing this and that the hostages have to be released. One of the people analyzing this said that maybe they didn't call for genocide because they deal with states and Hamas is not a state. It's unclear 100% what this all means, but it's going to take months to years to come up with a final decision. Yesterday also, the Israeli government accused UNRWA employees of being involved in the October 7th attack. They have not presented the evidence for this. I've heard this accusation has been brewing for a long time, but in response, prior to any investigation as to the truth of this, the United States, the UK, Canada, Australia, and Italy suspended their funding of UNRWA. This is going to be totally catastrophic. UNRWA has severed ties with 12 employees, but I think it would be prudent to wait for the investigation and not to punish the entire organization, which is keeping Palestinians alive. The other thing you should know is that Palestinians are taking the Biden administration to court. So this happened yesterday in a federal court in Oakland. They heard arguments in a lawsuit accusing the Biden administration of failing to prevent genocide in Gaza. It is thought that the case could bring U.S. support for the Israeli assault on Gaza to a halt. The claim has been filed against President Biden, Secretary of State Blinken, and Secretary of Defense Austin by the Center for Constitutional Rights, CCR, and the legal effort was taken on behalf of 2 Palestinian organizations, Defense of Children International Palestine and Al-Haq, which is a civil rights organization in Palestine, as well as 8 Palestinians that are living in the United States. At the time of this filing, the plaintiffs had lost collectively over 100 family members as a result of Israel's bombings. Barry Trachtenberg, a genocide scholar, had submitted an expert brief in the case. The other thing we need to remember is that there is a severe risk of a wider war, a regional war, which is just incredibly dangerous. This is an amazing photograph of a Houthi helicopter attacking a cargo ship. So we have Yemen's Iran-backed Houthis attacking ships in the Red Sea, and we have the US and the UK responding. We have Israel attacking Lebanon. We have Hezbollah doing drone attacks on Israel. We have Israel attacking people in Syria that they say are Iran-backed. We have Iran striking the Islamic State in Syria, and we have the US striking Iran-linked forces in Syria, in Iraq. So this is just a powder keg. And I think if we step back, the big picture involves issues of structural racism, apartheid, and cross-generational trauma and revenge. We see that Israel relies on military solutions to political problems. They seem to function with an utter disregard for the health and lives of Palestinian people, who clearly matter less than their Jewish cohorts in the eyes of the Israeli government. At times, we saw this during the COVID pandemic, Israel gives humanitarian gifts to the Palestinian territories, and they pat themselves on the back and talk about how generous they are. But it's important to remember that Israel is the occupying power, and it's actually responsible for the health and well-being of the people it occupies. I also want you to think about the difference between humanitarian pauses versus ceasefire. Humanitarian pauses are a week or two. It's being talked about again, where the fighting stops on both sides. And what this does is it allows people to regroup, to take a bath, to find some food, to get some water, to improve their shelter, and then wait for the bombing to stop. It's a pretty devastating psychological state of being. Ceasefire involves the end of hostilities and really is the only way that we can move forward. So I think that the crux of the problem, if we go on the big picture, is that the status quo can only continue if we as human beings see Jews as more human, more deserving, more innocent and honorable than Palestinian Arabs. If we as a community are blind to Arab suffering and the history of settler colonialism. And so the fundamental issue comes down to racism, which potentially leads to ethnic cleansing and genocide. And we also see that the health of Palestinians is intrinsically linked to their liberation and to the end of the siege. So we need political and healthcare solutions going forward. And these solutions must be using a decolonized framework. It's not going to be okay if Israel or the US tell the Gazans how they need to function. They need to have their own ability to function. And I just want to quote something from Dr. Martin, who's the founder of Physicians for Human Rights Israel. And she wrote that Jewish Israelis live, quote, in the politics of the last atrocity without historical memory. And she asks, how does Israeli behavior contribute to Palestinian resistance and violence? And she's written a lot on the separation or apartheid wall as both a physical barrier and a metaphorical blinder, concealing the existence of Palestinians and dehumanizing them. She also writes about the personal price this takes for Jewish Israelis who are dehumanized in the process as well. People have asked, what can we do? And this is my personal little list. I think the 1 to 1 million thing we need to do is to call for a ceasefire and contact our elected officials, which sometimes feels like a head-banging experience, but we need to contact them, as I say, early and often, calling, emailing, et cetera, going to their offices and demanding a ceasefire and reminding them of the price of this war. It's important, if you can, to demonstrate and to protest and to have a visible protest going on frequently. It's also important to educate yourself and not to just use mainstream media as your source of information. And then you have a responsibility to educate your community. Personally, I find Mondoweiss, Electronic Intifada, and Al Jazeera as excellent sources of information beyond the usual sources. It's also important for us to look at our media, to write letters to the editor, to contact whatever media you use or social media to correct inaccurate framing or assumptions that you find are racist or inappropriate. If you're in the healthcare field, there is a group called Health Workers for Palestine, which is organizing protests and other forms of demonstrations and protesting. I'm associated with the Jewish Voice for Peace Health Advisory Council, and we put out weekly updates on the health consequences of the war, as well as other actions people can take. There is also a new group called Doctors Against Genocide, which is working to stop genocide anywhere in the world, including in Gaza. And I have a website where I have all my writings and as much of my speaking as I can do. People also want to donate. There are a lot of good organizations. Ones that I particularly like are Médecins Sans Frontières, Doctors Without Borders, ANERA, Medical Aid for Palestinians, that's in the UK, Grassroots International, Palestinian Children's Relief Fund, but all of these organizations are doing good work. I'm just going to end with a poem that was written by a young man who is involved with We Are Not Numbers, which is a group that I work with. We Are Not Numbers is a Palestinian-run group that works in Gaza, started after the 2014 war, that helps young Gazans 18 to 30 to improve their English and to become powerful writers of their own story. And the idea was that Palestinians are often referred to as 300 dead, as if, first of all, they weren't killed and as if they weren't human beings. And so by putting their voices and their realities to the numbers, people will understand who they are. And through this recent attack, it's been very hard for writers to continue writing. Some of them have done amazing work. Some of them are in intermittent contact with their mentors, and the mentors take the fragments of conversation they have and put it together as poetry or as essays. And this was a poem written by a young man named Ahmed Dremli. He is originally from Gaza City, and his through the bombings at the time of the writing, I don't know what's happened since, he has lost his best friend. 9 of his cousins have been killed, and an uncle and other friends and family have died and are still under the rubble. So this is the poem that he wrote. I'm still breathing, but that is not enough to feel alive. I lost my loved ones. I lost my power, hope, dreams, and my last tears. Nothing can express the pain of losing the people who were a main part of my life. Nothing can erase the last look at them from my eyes. Nothing can stop replaying our memories before Israel took them away. And nothing can let me imagine moving forward with my life after them. Thank you. So I think now we're going to take questions.
Alice, thank you. And before I begin with the questions, I want to apologize to everyone for the sound issues. I am grateful that everyone but me could hear you initially, and I figured out another way to hear you as well. So I missed the very beginning, but oh my gosh, I guess my first question is, how do you continue when you have seen the before and the during? And the before was bad enough, and it's without words. It's without words. So
I feel very compelled to do this work, partly because as a Jewish American who grew up loving Israel and thinking it could do no wrong, and then becoming more aware of the history and settler colonialism and Islamophobia and imperialism and all the things that are important forces that have come to bear. I feel that American Jews bear some responsibility for this, and so this is my tiny part. I also have the responsibility to speak out as a physician and as a human rights worker, and also as an American citizen who pays taxes. It is our money that is funding this occupation and siege. Now, the other issue is that I started going to the region in almost annually until the COVID pandemic, starting in 2004. So I have an intimate knowledge of the region. I have an enormous number of contacts and friends and colleagues. So this place is very real. And so when, a bomb drops on Deir al-Balah, I know who I'm worrying about. I'm looking at my phone every morning, the moment I wake up, to see who has died and who is under the rubble and who's missing and all those kinds of questions. So I can't not do it. Now, you know, it does have a cost in that, you know, I've sort of given up sleeping since October 7th, but it's totally clear to me that I live in a very privileged position and I'm not living the life of the people who are suffering so much. So I basically have nothing to complain about. So my job is to figure out how to sustain this work. And one of the ways to sustain it is, you know, yesterday I went hiking and took the day off. But I also have work within a community that is all doing this work. And so we all support each other. And it is very empowering to work with people who are doing the work with me. So for instance, with the Gaza, I work with the Gaza Mental Health Foundation. So we meet and we talk and we keep each other connected and we try to figure out how we can support the Gaza Community Mental Health program in Gaza. And so you're actively doing something instead of being passive. Or with We Are Not Numbers, we're meeting, the mentors meet regularly. We support each other. We talk about what's happening with the young writers. We try to figure out how we can support them, how we can uplift their voices, because it's not like Gazans are voiceless. They have tremendous voice. They're just not being listened to. So I see it as my job is to be the microphone to this. The other thing is that one of the ways that I work on this is what I call culturally. And I became very aware that there is a total absence of quality books on Palestine for children and young adults. And so the last couple of years, one of my projects has been to write a middle grade novel and to write a young adult novel about Palestine, which I did, and they've both been published. And so it's another contribution because I feel like the narrative in the US is so inaccurate and so debilitating in terms of how Palestinians are thought of, that we have to figure out all sorts of creative ways to change that. And that was another reason why I made a documentary film. So I'm trying to use my privilege, my Jewish privilege, my white privilege, my creativity, and then my responsibility to keep moving forward.
All of us look to you as a model and how we can respond to what is happening throughout the world, not just in Gaza and the West Bank, clearly. Thank you. And actually, that's a good segue into one of the questions that was posed prior to this morning. I'm familiar with the two books that you have written for adolescents. I've read the first one. How are they being received? And have you had any pushback from, say, the mainstream Jewish community?
So the young adult novel is called Finding Melody Sullivan, and that came out a year ago. And the middle grade novel is called Old Enough to Know, and that came out about 2 weeks ago. So when you write a book about Palestine, you know, Random House does not come rushing over to publish your book. So I got published by a small progressive press, which has zero to very little marketing. So whatever marketing happens because I'm out there reading it and doing webinars and that kind of thing. So I'm flying under the radar. And so my big challenge is to get this book into libraries, into schools. You know, I put my name on a list at the Seattle Public Library, local author, happy to read in any school, and I got zero interest. So this is a topic that no one wants to hear about, that people are afraid to bring in their schools. Teachers who talk about Palestine often get tremendous pushback from, you know, parents, from principals. They have been doxxed, they have lost their jobs. I mean, it's a really difficult place. So I haven't risen above the radar high enough to be noticed by people who would push back. I mean, occasionally I get hate mail, but nothing major. And that's a reflection of how hard it is to get books like mine out there. I mean, people who read it like the books. It's just that not a whole lot of people are reading them. So you all out there can fix that by reading my books and asking your libraries to carry them and asking your schools to host me, and I will come and read or do a webinar and read or whatever it takes. So this is, you know, an uphill battle, which everyone who's trying to talk about Palestine tends to face.
And I have already placed in the chat the link to your second book, which will also take everybody to the first book as well as more information about you, Alice. So I'd like to, before I begin or continue with the next question, just remind people to go to the Q&A to ask your questions, and we will take them in the order. These are still questions that were submitted prior to this morning. Realistically, what can we still do to support while we are trainees? I'm not sure what that means. I presume they are talking about, we presume that these people are talking about medical training, because several questions came from Northwestern University Medical School. Interesting. A lot of people are scared to speak out and to be doxxed.
Right. So people who are in the healthcare world, I think, have a particular credibility because they're in the healthcare world. And it is also very challenging because there's a lot of pushback. And there are, evidence that people who speak out, particularly in training, do take some risks. And so what I would suggest is this, that it is very important to organize within your community, to have educational events, and to help your community understand what's going on in terms of health and human rights. You do need to be very thoughtful about it, and you need to speak with facts and not have a lot of opinions, because you want to be able to defend yourself when the head of the hospital calls you in, or when the dean calls you in, or when the residency program says they don't want you because you said something sympathetic about Gaza. So it's important to be very thoughtful, but I don't think that this is a time to be quiet. It's a time to be strategic. It's a time when you go to a protest, wear your stethoscope, wear a white coat, make it clear that you're talking as a medical professional. The other thing that, and I wrote an op-ed about this that was published in the Seattle Times, I have been pretty horrified by the silence of healthcare professionals. There, as I said, there is a Doctors Against Genocide group, but the only medical group that has spoken out on this is the American Public Health Association. So, the Orthopedics Association has not said, anything about the number of orthopedic injuries. ACOG, the American College of OBGYN, has not said anything about all the pregnant women who have no prenatal care. The Pediatric Association has not said anything about the fact that 2/3 of the people who are dead are women and children. So it is important also for we in the medical profession to be pushing our professional organizations to speak out. So this is, something that requires thoughtful, careful organizing, be in community. And also, if you're doing, saying things on social media, be thoughtful. Don't just, let your rage go off on social media, because that little text will be read to you when you're applying for your residency. And so you don't ever want to have that happen to you. So be really thoughtful and cautious on social media.
Excellent, excellent suggestions. Thank you. I have a request for you to spell the name of the poet and any kind of link that you can put in for the poem that you read.
His name is Ahmed, Ahmed, Dremley, Dremley. You should also know, this is something I've learned, that Palestinians have several names. They'll have their family name and then they'll have their grandfather's name. So he doesn't always go by Ahmed Dremley, but that's the name he wrote under this poem. If you go to the website, We Are Not Numbers, it's wearenotnumbers.org, you can read all the things that young people are writing, and it's very, very powerful stuff. And some of it is about losing their brother, and some of it is about the beauty of the Mediterranean Sea on a full moon night. So it's the beauty and the trauma and the sadness all mixed together.
Okay, I'm trying to put that in the link in the chat, but I will do that. Next question. There is a lawsuit against the U.S. and President Biden accusing him of not stopping genocide. Will it work to change the pattern of this war? And then the subsequent question, if Mr. Trump becomes president again, do we know how he would deal with this tragic war?
So I am not a lawyer. I know the people who are bringing the lawsuit against Biden. I do not know, if the court supports the lawsuit, I don't know personally, what hoops then get jumped through to stop it, or, I don't know technically what happens. People are very excited about this. And I think what we're looking at is all these attempts to provide legal pressure to change the US government policy. the forces allied to want to support Israel and to spend, many, many billions of dollars for the weaponry that they're using to kill people are very strong. There is a huge Israel lobby, which is largely Christian Zionists as well as Jewish organizations. And there is a massive military, corporate, industrial complex that is very invested on making a huge amount of money and a huge amount of connections between the two countries. So it's going to take a lot to change US policy, but I think this will be another bit of pressure. I have no idea what the legal, how it all works legally, because I'm a doctor, not a lawyer. In terms of the orange one, whose name will not be mentioned, I can't imagine what he's going to do. It's not going to be anything good. And I think we should be very afraid. His idea of a peace plan was the Abraham Accords, which basically made a deal with several Arab countries that are now very pissed off, by the way, to give them tons of weaponry in exchange for recognizing Israel and throwing the Palestinians under the bus. So I wouldn't look towards him for anything but something really, really awful, which is another reason why we must not let him get elected.
We don't have much of a choice right now, do we?
No.
Next question. Thank you for your commitment, Dr. Rothchild. What can you tell us about the health consequences of mass incarceration of imprisoned Palestinians? And I presume that means imprisoned in Israeli prisons. Also, if you could help me understand what is the US interest in facilitating genocide?
Okay, so if you look at Palestinian prisoners, the Palestinians that get arrested in the occupied territories go to an Israeli military prison. And I should tell you that the number of arrests in the West Bank has skyrocketed since the war started and has dwarfed, has been much more than the prisoners who were released. So what the Israeli military or soldiers do is that they will arrest Palestinians for all sorts of, quote, crimes. They arrest children for throwing rocks. They have this policy of invading people's homes in the middle of the night, stripping everyone, making terrifying children, grabbing a kid. I mean, just awful, awful practices. So that they have a large number of prisoners that are considered by Palestinians to be political prisoners or to be considered innocent children. If a Jewish settler kid throws a rock, no one arrests that kid and puts them in jail. If a Palestinian kid throws a rock, that's really bad. So what happens is that the person who's arrested gets taken to be processed, and then they get put in what's called administrative detention. Now, the interrogation that occurs is without a lawyer present. Oftentimes, the family doesn't know where their family member was taken. It's often under fairly brutal conditions. There's a lot of evidence of techniques that would be considered torture techniques. And it's a very brutalizing process. And the main goal is not to find out, this is how I read it, whether that person is innocent or guilty, but to create enough fear that they will be willing to become a collaborator. So there's a whole act that's going on here. And then people get put in administrative detention for weeks, months. And this detention is no charges and no lawyer, and you just have to wait. And so Palestinians are caught in this limbo where they're not convicted of something, but they're not allowed to come home. And then at some point, they either go to trial or they get released. So I know many, many people, colleagues, professional people who've spent months and months and months in administrative detention without charges, and then one day they're just released. Now, if they go to court, and I have been to Ofer prison and watched some of the court proceedings, it's pretty awful. It's conducted in Hebrew. The prisoners are brought in, handcuffed. They're terrified. Often they're children, and they have an Arabic-speaking lawyer, and it's a military court, so it's all military judge, military presenting the evidence, and the prisoner is not allowed to know the evidence until they get to the court. And they have a 99, I think, 7% conviction rate. So it's kind of a kangaroo court. And then they get sent off to jail. And the jails are pretty brutal. The Israeli government has decided to make conditions worse since October, which is hard to imagine. And, the families petition, I believe it's the Red Cross, to let them visit. And there are buses that go, to bring families to Israeli prisons. And the families travel hours and then, have half an hour with their loved one behind a glass wall kind of thing. So it's a pretty brutal, oppressive situation, and it's not that related to justice. So that's, and there are prisoner, defense groups in the West Bank and Israel that work on this. But it's a pretty, it's an important part of Palestinian life because a large percentage of Palestinians do have this experience, and it's related to living under occupation and siege.
Sounds like Russia's taking lessons from Israel or vice versa in terms of how to handle prisoners and arrest them to begin with. Thank you. What impact do you think the ICJ decisions will have on the disaster occurring in Gaza?
Oh, you know what? I didn't answer the why does U.S. support genocide question, which was the second part of that question.
Yep.
The U.S. is claiming it's not genocide. So the U.S. has officially said, Israel has a right to defend itself, and that's what they're doing. I think privately they're trying to urge Netanyahu to cool his jets, but as long as they keep sending billions of dollars of weaponry, then he's not going to cool his jets because he doesn't listen to what people say. He listens to what people do. And as long as he's getting the weapons, he doesn't actually care. So what was this new question? Oh, what does the impact of the
ICJ?
The International Criminal Court?
Yes.
Well, the International Criminal Court in the past issued a ruling on the separation apartheid wall, which said that it was illegal, and Israel totally ignored that. So I would suspect that the Israeli government, once this decision comes down, and like I said, the final decision is going to take a very long time, they will probably just ignore it because they ignore ICC decisions in the past. I think the power of this is to change public opinion and to change international pressure, because the Israeli government is not going to change on its own. There has to be international pressure to convince it that it is no longer okay to behave this way. And it's not going to change unless we make it change. So I think it's part of a change in international opinion.
Thank you. Is there evidence for depleted uranium having been used in Gaza? I'm thinking of Fallujah and Genesis.
Right. I haven't seen that. We don't know all the weapons that are being used, but I personally have not seen any evidence for that. I don't know if anyone else in the audience has, but I have not. But you should know that Gaza is a place where new weaponry is tested. If you go to like a big military show, Israeli weaponry is described as field tested, and field tested means that they've tried it in Gaza to see how good it works for them. So Gaza is like a testing site. So I don't know what weaponry is being used there, but it's probably new and awful.
All right, thank you. This question, some of it was kind of answered, but I guess there is a bit of a coda here. Do you have any explanation as to why Biden seems to be so enabling of the Israeli government's immoral actions? I'm trying to explain it by wondering if Biden is afraid of alienating potential voters who favor Israel in the incoming election.
Well, I can't speak for Biden, but I suspect that he has a longstanding love of Israel. He's very supportive of a Jewish state. He's went and gave Netanyahu a big hug after the horrific Hamas assault. So I think his emotional, intellectual sympathies all go there. I don't know what his level of racism is towards Arabs. I cannot speak to that. What was the second part of the question?
Is he afraid of alienating voters?
Oh, alienating, yeah. So, I do think he's a political animal, and that the Israel lobby and the Christian Zionists are, in particular, are a very major voting bloc, and he doesn't want to alienate them. He also doesn't want to alienate liberal Jews who are unable to make the step of criticizing Israel, since in the mainstream Jewish community, any criticism of Israel, particularly after this horrific assault, has been defined as, anti-Semitic, anti-Israel, blah, 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 rather than as criticism of a country that is doing something out of order. So, what I often say is that Hamas's war crime does not justify Israel's genocide. He's not willing to go there, and I'm sure he's getting pressure from, the military establishment, the people who make the weapons, the big and powerful who are making a lot of money off of this war.
I think it's multi-layered. I would question if Biden would ever get the Christian nationalist vote anyway.
Right.
However, the liberal Jews, that's certainly another issue. I certainly think he's got those people in his radar. On the other hand, he's losing a lot of young adult votes by his actions. I think we all know that. I heard a while ago that hospital ships, possibly from France or Italy, might be parking on the shore of Gaza, but apparently that has not happened. Do you know why?
I've heard that too, and I don't know why. I do know that Jordan set up a field hospital in Gaza, so that's like bringing a temporary military hospital into a place, and the Israelis bombed the field hospital. So I don't know why, but I would suspect that the Israeli Navy does not want hospital ships right outside of Gaza. But I don't. That's just speculation.
Kind of a duh, maybe. That concludes our questions. There possibly are a couple more. Let me take a look here really quickly. The City Council of Minneapolis has passed a ceasefire resolution this week. I happen to have been at the council when they introduced the resolution. Many cities across the U.S. have passed similar resolutions. Might Biden and the administration be influenced?
Well, we can only hope. I think every city, every council, every group, every union that calls for a ceasefire is increasing the pressure for a ceasefire. And I don't know what the tipping point will be, but I think that's what we have to do. We have to make this ongoing war morally unacceptable and politically unacceptable. And that's one of the ways to do it.
Okay, are there any other final questions?
I think there are questions in the chat.
Okay,
you
see them. Do you want to go for it?
Okay, let me just see. Okay, this is conversation.
The VA was more of a statement, and everybody can read that. I see one. I've wondered if the Gaza bombardment will be used as advertising to tyrants who seek to control their people or take over land. Not exactly a question, but wondering.
Every time something unacceptable happens and it becomes acceptable, I think it certainly makes it acceptable to do again. One of the things that really, really worries me is that there's a massive amount of weaponry that's being poured into the Middle East. And I'm sure that much of it is not going to be used in a positive way. And so, I would suspect that this will only facilitate other leaders feeling that they can work without compunction and with impunity. But I can't. I don't know what tyrants are thinking these days, but certainly it's not a good trend. And we need to figure out what kind of world we live in, and if this kind of war is acceptable to people living in this world. And I think the more it becomes acceptable, the more dangerous the world becomes. And so, since civilians and regular people are the people who pay the price for this kind of stuff, we are the people who have to work to make it unacceptable.
Thank you. I did find a couple other questions in the Q&A. There's an article in the Jerusalem Post today, and this is a while ago, that Gazans are calling for the overthrow of Hamas. Is this a possible path forward?
So I haven't seen the article. If you look, this is my understanding of how Gazans feel about Hamas. And again, I'm not a Gazan. I haven't done a poll. I haven't read something recently. But when Gazans voted for Hamas way back, they were voting for clean government, and they were voting against the corruption and ineptitude of the Fatah group that was running Palestinian Authority. When Hamas took control, there were all these expectations, since Hamas is not only a military group, it's also a group that has done a tremendous amount of social service work. It's set up hospitals and orphanages and social service organizations. And it's also a group that's concerned with living as a good Muslim. It has all different, it's not monolithic, and there's a wide range of political tendencies within Hamas. There was hope that Hamas would be able to create a better world for the people living in Gaza, and that they would be able to have some kind of negotiation with Israel. And, you know, when people say, well, Hamas will never negotiate with Israel, Hamas participated in an election which showed that they were willing to be part of a system in some way. It's also important to note that the Israelis have systematically assassinated all the moderate Hamas leaders. And in fact, the most recent assassination in Lebanon, I've forgotten what his name is, but he was the Hamas person who was negotiating for the hostages. So this is like an interesting policy the Israelis have to keep the moderates dead. So as things got worse and worse and worse in Gaza, related to the siege, people became much more disenchanted with Hamas because they haven't been able to deliver. And the more disenchanted people got, and the worse the situation got, the more the militants became a more predominant side of Hamas policy. And, you know, the more the militants became powerful, the more people felt like, well, they're the only ones that are speaking out for us. So that you can see how the circle works. I think at this point, folks in Gaza are very proud that Hamas actually challenged the big Israeli military, and they were able to do something that hurt them. That the Israeli military had all of the plans that Hamas had through their collaborators. I was in Gaza on the eastern side in someone's home looking over their olive groves, and we could see the Hamas training facility right up against the eastern perimeter, right near a big guard tower that has all the guns sticking out. And so the Hamas folks were practicing right under the noses of the Israeli military. And the Israeli military basically thought, these people can't get this together. They're not a threat. Don't worry about it. And they ignored all of the signals that were right in front of their nose. And so the fact that Hamas was able to pull this off and pull it off in a very creative and horrifying way makes Gazans who have been deeply oppressed proud. Do they support this as a method of negotiating in the world? Not particularly. Do they support, being bombed and being dispossessed and crowding together with 50 other relatives in a small apartment? No. So the conditions are so terrible that I would highly doubt that Gazans are supporting Hamas. That what they need is a ceasefire and for some humanitarian aid to come pouring in, and then they need to have the boot taken off their necks and the ability to figure out what their next steps are. And so a lot of the time, thinkers on this are thinking about the decolonization of this conflict. So it is not going to work for Israel, the Israeli government, to dictate how Gazans are going to live and what kind of government they're going to have. It is not okay for them to do that in the West Bank either. That will only continue the ongoing crisis and the ongoing injustices that happen. So decolonization implies that the people who are living there get to decide their fates and how they want to govern themselves and how they want to live. So that's a much bigger conversation, but that's, I think, the direction that we need to go in. And I see someone posted that Sarah Roy has written on this, and she's just a fabulous scholar on Hamas and a dear friend of mine.
Thank you. I just had a thought and now I dropped it. Anyway, many Israelis who died on October 7th were killed by IDF fire. Many others were IDF soldiers. How can this story get out? I know it's been out a little bit, but not in the mainstream sources.
So, there are a lot of tragic stories that have not gotten out. So this one is about the fact that when the Hamas attack happened. First of all, there was total confusion within the Israeli military. It took them a while to get there. And then when they got there, they did something, which I think they call the Hannibal theory or something like that, where they arrived, and were willing to sacrifice Israeli citizens to prevent, to kill Hamas fighters. And so a certain percentage, and I don't know how many, were killed by their brothers and sisters in the military. And then a certain percentage were killed or injured by Hamas. And this story came out and it didn't fly very far. Another story that's been very difficult to have is the whole accusation of mass rapes. This came out, the day after, massive accusations of Hamas committing mass rapes. Further analysis and further discussion about this has been extremely troubling because there's actually no evidence that Hamas committed mass rapes. I mean, if they did, we need to know about it. And if you look at other conflicts where, in war, these things do happen, it's taken months of careful investigation and gathering evidence and that kind of thing to come out with making that assertion. And the fact that this assertion came out the day after the attack is more of a trope about, the savagery and sexuality of Arab men. And we see that in, American history and African-American men getting lynched. So I think that this needs to be investigated by an independent investigator, not by the Israeli government or the Israeli military, because they are really terrible at this. And we need to know. And if it happened, we need to punish the people and condemn it and to make it public. But if it didn't happen, then that needs to be stated as well. And there was a very good analysis in the Electronic Intifada about this. It was a podcast by Ali Abu Nima on sort of the political dynamics of this accusation and the tropes it fed into. And even the New York Times had this really sort of powerful essay about it, and they talked about the woman in the black dress. Well, it turned out the woman in the black dress who was dead and who they said was raped, according to her family, was not raped. So there's a huge amount of disinformation or people grabbing onto things that fit their preconceptions that are not related to the data. And one more thing I'll mention, there was an amazing interview on CNN with Ehud Barak, the former prime minister. And the interviewer was talking about the tunnels under Al-Shifa Hospital. And he looked at her, he said, what are you talking about? The Israeli engineers built those tunnels in the 1980s. We were building tunnels under hospitals in conflict zones to make them stronger in times of attack. I mean, we have tunnels under our hospitals. What are you talking about? Those are not Hamas tunnels. And she looked at him like her eyeballs were about to roll out of her face. And so, even the tunnels, I mean, clearly Hamas built tunnels, but did they build tunnels under hospitals? That is completely not clear. And perhaps, particularly with Al-Shifa Hospital, is just not true. So the fact that the Israeli military has systematically, and this is systematic, gone after every hospital, bombing it, bombing around it, bombing health centers on the idea that there are tunnels under it that the Hamas people have built is probably not true. But we'll never know because the media seizes what story suits the story that the powers that be want. And so that's why I think we have to be very thoughtful, very cautious, not just jump on the bandwagon when we hear something, and take a deep breath and have the investigations happen to figure out what is actually going on. And I should also mention that according to international law, when a hospital has patients in it, no matter who is in or around or under the hospital, it is against international law to ever bomb a hospital or a healthcare facility. If it's functioning as a hospital, it is against international law. So every one of those hospitals that have been bombed is a war crime. And I think we have to be really clear on that. But that's not the narrative in the media. And you should also know that the Israeli government and various organizations in the US spend millions and millions and millions of dollars shaping the narrative on Israel. And so we have to be very thoughtful and look beyond the mainstream to come up with a better understanding of what's going on.
Alice, one reason I wanted to have you back, and you did speak with them with MEN in person about 5-6 years ago, and we have been friends ever since. The way you articulate every question is just so cogent, and I thank you for your articulation in addition to your realm of experience and personal encounters with what is happening. You're extremely important in this conversation, and I know we all thank you. Someone is saying, I agree completely. We could go on, but we are out of time. Again, my huge apologies for the sound issue initially, but I did record the forum, and it will be posted within about a week or so. So look out for that. And I have just posted in the chat 3 different links. Last January, exactly a year ago, we had a young man whose name is Jihad Agandar from Gaza. He was fortunate enough to have spent a year here in the Twin Cities area of Minnesota at a high school, White Bear Lake to be specific. We have been worried about him and his family ever since. They are in the Rafah area, hoping to get out permanently of Gaza. And so the family here that hosted him has started a GoFundMe. I posted that link in the chat. It's called Jihad's GoFundMe. So if any of you watched that and have a personal feeling about Jihad and his family, we encourage you to give any amount that you possibly can. Even if you didn't see that forum, if we can help one family, we can help someone.
Can I say one thing about getting out?
Absolutely, absolutely.
So, I've done a lot of thinking and work and talking with people about all the efforts to raise money for particular families, which is totally good and totally understandable. I think people need to understand that to get out, you have to get on a list that makes it possible for you to then get a permit. And to get on the list, there is now or there was in the past a system where you paid, $250. I think it goes to Egyptian security, but I'm not sure, to be able to get on the list to then have the possibility of getting a permit. That price has now, I think, gone up to $10,000 a person. So there's a massive amount of, I don't want to call it bribery or, taking advantage of the desperation of the system. So as you raise money, which you should be doing, you should think about, if someone has a family of 10 people and you raise, and by some miracle, $100,000, do you want all of that money to go to the Egyptian bribe to get on the list to possibly get out? Or would that money be better used to feed that family while conflict is going on? I'm just raising this as an ethical issue and as a way to think about what you're doing and what you're doing with your money. There's no right answer here, and I'm not implying there is, but I think you should be realistic about it. Once you get out, most people have to leave Egypt within, I think, 3 days. And so you need to then have, the ability to support the family to get out of Egypt and then to where they're going. So it's not just raising money to get them out. It's a whole multi-step process. Many of these families get out and they have nothing, zero, nada. And so they are desperate. And so it's a big deal, and you need to think out all the steps.
Once again, a conundrum.
Yes.
Thank you, Alice, for that. And I'll look into that personally as well and respond to our members. The second link that I have posted is we always post a very, very short survey. We would appreciate hearing from all of you as to what you think about Dr. Alice, and I know what the answer is going to be, and about the format of our forums in general. And please be a little kind to me about the sound issue. And finally, if you like what you see and hear, we strongly encourage you, if you have not given any kind of donation to Middle East Peace Now, we encourage you to do so. We do pay our speakers honoraria. Alice is doing this as she said, she's doing as much as she can in terms of her speaking engagements. And it costs money for this to happen on both sides. So we strongly encourage you to donate any amount that you possibly can. The link as to how to donate has been posted. I have a question to send out the web addresses in the chat, and we will do so. We will be sending out a follow-up email to all of the attendees and beyond as to how to watch the recording and also to view the links that were posted. Alice, do you have any final comments?
No, I think this was a very powerful discussion, and I'm going to put, there was a question about NGOs, so I just put that in the chat. I think the main thing, that some people just throw up their hands and say this is hopeless. And I think the thing to remember is that just like in other places in the world, Sudan, Yemen, we could make a long list of places where people are undergoing tremendous amount of suffering, that it's really important in whatever place you get involved with not to turn your back and to remember that there are people that are suffering and people that are innocent, and even people who have been involved in resistance, that oppressed people do have a right to resist. You may not like how they're resisting, but that Palestinians have been living under a tremendous amount of oppression since long before 48, and that we're partly responsible for that oppression. And, we can understand the founding of Israel and the Holocaust and all those issues that people will bring up, but ultimately, Palestinians have paid the price for it. And I think that's something that we need to remember and we need to take responsibility for. And you don't have to make peace in the world. You have to do your little part. And so pick a part that you can do and do it. And that's what we each need to do.
I'm reminded about 30 years ago, I had a group in Jericho and met with, at that time, Yasser Arafat's public relations director. His name is Sami Musallam. And his statement was, you treat someone like an animal long enough and they begin to behave like animals. And that statement just never left my mind and heart. I do have one final thing to announce, and that is our February forum will actually be one of the two in-person events that we do on a yearly basis. And that will be February 17th here in St. Paul, Minnesota at Gloria Dei Lutheran Church. We have 3 panelists representing Muslim, Jewish, and Christian backgrounds, and they will discuss the Israeli-Hamas war and genocide from their perspectives. We're really looking forward to this event. It will be a potluck event. And if you live in or near the Twin Cities, we encourage you and hope that you will be able to attend that. Watch your emails for further information on that. And to that, I will close the presentation. Again, our great thanks to you, Alice. It's good to see you again. And everyone have as good a day as you can under the circumstances. Thank you all.
Thank you very much.
I'll leave this open for a few minutes so that people can look at links and do the survey.
So I'm leaving.
And you'll sign off, Alice.
Okay. Bye.
Bye-bye.